Hi Mandy. So,
Hi.
what's the problem?
Well, I haven't been well for about a week. I've been off work with a really bad stomach pain and diarrhea. I thought I picked up a bug and it would get better, but it hasn't really.
Okay, so you've had some abdominal pain.
Yeah.
Okay, I'll just pop that up on the computer there for a second. Okay. So I'm having a quick look at a list on the computer there. Fine. So you've had this for about how long?
Yeah, 1 week.
A week. Okay. And what does the pain feel like?
Well, it's all over the tummy and it's really uncomfortable.
Mm-hmm. Have you had any diarrhea?
Yes, yes. In the last few days.
Mm-hmm. Okay. Any blood or mucus with the diarrhea?
Well, there was some blood in my stool for a couple of days last time that I had this pain. Then there wasn't until last week that there was again.
Okay. Okay. I'm just entering a few symptoms on the computer. Have you had any symptoms like this before?
Well, I was here a few months ago. I came to see the locum, and he suggested I picked up some bag, and he gave me Imodium,
Mm-hmm.
and the pain went away. And I don't remember having trouble before that.
That was about how long ago?
4 months ago.
A month ago.
Four,
4 months
sorry,
ago.
4 months ago.
Okay. How's your appetite?
I don't feel like eating that much.
Okay. Have you lost any weight?
I think a kilo or two because I'm not eating.
Okay. Okay. Fine. And when was your last period?
3 weeks ago.
No
It was
problems
the
with
same
that.
as usual.
Any urinary symptoms? Burning or stinging?
No. No.
Okay. Okay. We'd like to sit up on the couch there. Let's have a feel the abdomen.
Okay.
We'll stop at that point. And I'm going to show that there's a fair juggling act with doing this with the patient in the room, getting information. But with practice, you start to be able to enter information whilst talking to the patient without it being too intrusive. So I'm going to show some of the features of the interface at this point. So you can see that inflammatory bowel disease moved up the list as I was entering information. It's now at the top. If I pick and urinary tract infection, which was higher up the list, has moved down. If I pick urinary tract infection, you'll see that I've got a variety of symptoms and signs which are associated with that, one of which is no. Now if I select all of those, no, I can eventually make it disappear off the list completely. As you see, they're now adding on the left hand side as I'm selecting them on the right hand side. And it's gone. Almost? No, one more. Yeah, it's gone now. Okay. There are also possibility to enter synonyms, so I'm going to add SOB for shortness of breath. So it picks up SOB, which is a usual shortcut in the GP. If I click shortness of breath and add that, what actually gets added is dyspnea, the symptom. So we're picking up both local and read code synonyms. So we're going to move on now to make a diagnosis. So down here I've done. and it's reminding me that I haven't ruled out ectopic pregnancy, so I could reconsider this thing, and it's appearing now in red. And I can look at the questions there which I haven't addressed, and I can say, well, the urine pregnancy test was not positive. And I can say, well, okay, that's fair enough. That's good enough for me. So I'm going to put my working diagnosis in here, which was IBD, inflammatory bowel disease. Click OK, and all of that information is now entered into the health record, with the history here, abdominal pain, which was our presenting complaint, our reason for encounter, with my text qualification next to it, the diagnosis, and then all the symptoms and signs that were recorded during the consultation, all with their correct read codes and all in the correct record structure for Vision 3.